Okay, good afternoon everyone. Welcome to today's Menzies Research Seminar. As we begin, I'd like to acknowledge the traditional owners of the lands that we're gathering on today, the Larrakia people, and pay my respects to their elders past, present and emerging. I'd also extend that respect to any Aboriginal and Torres Strait Islander people who are here with us today or joining us online. It's my absolute pleasure today to be joined by Dr. Chris Lowbridge in the room with us and Dio Ximenes online in Timor-Leste, who are going to be presenting to us today about measuring the burden of tuberculosis in Timor-Leste. So I'll hand over to Chris first for an intro and then over to Dio. Thanks so much.
Thanks very much, Patty. Yeah, good morning, everybody, and thanks very much for joining here today in the room and to everybody online. So it's a great pleasure to introduce this talk today, which we're going to give an update and overview of the National TB Prevalence Survey at Timor-Leste. So just to introduce myself, I lead the Menzies TB Research Program, and I'm one of the co-principal investigators for the TB Prevalence Survey. So this project has been a significant sort of priority of the Ministry of Health of Timor-Leste for a long time. And we've had the opportunity for Menzies to support the Ministry of Health to undertake this sort of big and very important project. It's a large and ambitious project, which as of today has seen more than 15,000 people in Timor-Leste screened for TB. And so to talk a little bit more about the project, I'm going to introduce Deolindo Ximenes. So Dio is the Data Science and Health Informatics Technical Advisor for the Menzies Dili office. He has a background in nursing and has completed a master's degree in health informatics at the University of Wollongong. He provides data science support across a wide range of Menzies projects, including the National TB Prevalence Survey, as well as health informatics, technical advice and capacity building to the Ministry of Health and other partners and stakeholders in Timor-Leste. So Dio's joining us online today, and so we're going to hope that the internet connection to Timor holds up. So I'll pass over to you now, Mondio. Do you want to take over?
Yes, thank you, Dr. Chris. I appreciate for the great introduction. Can I just check here? Am I audible to everybody?
Yes, we can hear you loud and clear.
Thank you. So good morning, good afternoon, everybody, whoever you are, with some online and offline. It's 11:30 here from Timor-Leste. It's beautiful sunny day here. And before I start my talk, I would like to acknowledge and pay my respect to Timor-Leste's heroes and veterans who fought against the invaders. And today is a public holiday celebrating the unilateral proclamations of independence in 1975. So thanks so much for the sacrifices. I'm extremely honored and pleased to represent the team to provide this talk. And this study is a huge collaboration between Timor-Leste and Menzies School of Health Research. So we are thrilled to share with you our overview and the progress of the prevalence TB survey in Timor-Leste. The objective of this study is to provide the progress of the work since its rollout up to now. And I'll provide some background on TB situations in Timor-Leste. I'll talk a little bit about Timor-Leste's country context for those who are new to Timor. I'll describe some of the results that the methods that we used and some of the new approaches we use specifically in this survey. Yeah, so For those who are new to Timor, so Timor-Leste is a small country. It's located between Australia and Indonesia, but it's part of Southeast Asia. Its recent census shows as with the 1.3 million populations. It was one of the Portuguese colony over 400 years before it was invaded by Indonesia in 1975. So and it gets its independence in 22. With its age, it's a relatively a young country, so it still faces lots of challenges, including malnutrition, lack of infrastructure, and high unemployment. But despite all the challenges, Timor-Leste has made some significant progress in the recent years. With its geographical locations, Timor-Leste's culture shape influenced by the Austronesians, Melanesian, and Portuguese and Chinese heritage. For those who love diving or snorkeling or hiking, Timor-Leste has clear waters and beautiful coral reef that you can enjoy. And it's just one and a half hour flight from Darwin, and it has 3 connection flights, Bali and Singapore. Next, yeah. So for this is the for those who are not familiar with the TB disease, so tuberculosis is an airborne transmitted disease, so it can be transmitted through coughing, sneezing, or people or speaks. It's caused by a bacteria called Mycobacterium tuberculosis, and it's one of the leading infectious cause death globally. Most it affects people's lung, but it can affect other parts of the body as well. Despite its burden, TB is a preventable and curable disease with a specific oral antibiotics. The only downside is that it takes the treatment takes longer, and that sometimes people drop the treatment. Yeah, so this is on the left side graph, it shows the incidence, the new and relapsed TB case notifications, and the TB HIV co-infections. The line, the projections for the TB rates is calculated annually, and it's being remain unchanged over the last 10 years. With the wide, you can see the gray area. It has wide confidence intervals. This is due to the lack of and poor coverage of TB notification system and vital registration. With 498 cases per 100,000 populations, it makes Timor-Leste as a sixth highest country globally. Interesting thing to see, there's a gap between the black line and the green line. It shows that many Timorese people still remain undiagnosed and untreated. And then the right side, on the right side the graph on the right side shows the mortality rate prior to the decline in 2022. Timor-Leste was among the very highest TB mortality rates globally. So compared to other parts of the world, Timor-Leste has relatively low levels of drug and drug resistance and TB HIV co-infection. The survey data from 2016 found that most TB patients in Timor-Leste, they face catastrophic cost due to the diagnosis, due to their diagnosis, and it shows a significant impact on the socioeconomic of the disease. The graph on the right shows that the undernourishment is a major risk factor driving for TB epidemic in Timor-Leste, following by the smoking and alcohol disorders. Yeah, next, thank you, Chris. So TB prevalence survey is the best way to measure directly measure the burden of TB disease in the populations. And Timor-Leste is in a good position to have its first TB prevalence survey due to the estimate of the high burden of disease and the absence of poor coverage and a national notification system and the vital registration system. Due to it follows the standardized methods, it provided reliable measurements for people with confirmed pulmonary TB and at a given point in time, and the results can be compared to other countries. So the primary objective of Timor-Leste prevalence survey is to provide a robust estimates of the prevalence of TB in Timor-Leste, and as this is going to be the first time to be ever done in Timor-Leste, this will be a perfect baseline to provide future measurements of progress and TB elimination program. The secondary objective is to contribute to national case findings activity through the identifying previously diagnosed, undiagnosed people with TB and linking them with the treatment and ongoing care. Yeah, so some of the activities our team were doing on the field that they screen positive symptoms TB, and if the result confirmed with gene expert positive, there will be district TB coordinator. They'll be facilitated by district TB coordinator, and they'll be connected with the treatment at CHC level. Next. So as I said earlier, this survey is a collaborative work. Consists of a Minister of Health of Timor-Leste, Menzies School of Health Research, and our key stakeholders such as WHO and some other organizations that also provide TB programs. So the structure consists of a central team and field teams. At the central level, we have 3 principal co-investigators, Dr. Chris Lobris. He represents Menzies Research of Menzies School of Health Research, and we have 2 Timor-Leste principal investigators, and Mr. Costa Lopez, if he's here, and Dr. Josephine. So they are the head program of National TB Program. We also have TW group that normally we have a meeting to provide strategic advices and inputs throughout the progress, and we have a meeting once or twice in a month. We also have co-investigators that come from other key stakeholders. From the field team consists so we have 3 field teams, and they consist of doctors, radiographers, nurses, researchers, research nurses, and the driver. So once our team's on the field, we also have community volunteers and laboratory technicians and DTA and chief of Aldea, chief of so it's Aldea or Suku is the lowest administration's level, and so it has very supportive team. Yeah, so the survey design is nationally cross-sectional randomized cluster survey. The sample, which consists up to 20,068 people across 50 clusters and is stratified by urban and rural area. You can see on the map on the right side. Survey participants include persons who they are aged 15 years and older and live in the selected cluster area. For our inclusion criteria, it's defined 4 levels. So from national cluster, household, and individual level. So each individual has a chance to randomly selected by the class from the cluster where they reside. And for the exclusion criteria is that mostly it's the opposite of the inclusion, but we also for those who are living in congregate settings like school boarding or dormitory, we don't include them. And of course, those who are unable to provide consent. Next. Yeah, so consultations with stakeholders has been paramount throughout the planning and implementations of the survey. So this includes the national launching. The engagements include Ministry of Health, WHO, other stakeholders through convening a technical working group. And then our team also conducts various socializations and meetings at national, through municipal and local levels. We, on the ground, our team working closely with the community leaders, district program staff, and assistant district program staff, and the community health center staff. With next, Chris. So in terms of the field procedure, the field teams carry out, so once they arrive on the selected clusters, they'll be visiting house to house to enumerate people, looking for, identify the eligible participants and invite them to the screening site. So for those who are eligible, it means that age 15 years or older, they'll be registered at screening site and they will have a chance to have X-ray screen and then this X-ray test and then symptom screen interview. If a participant has TB or at least one or more TB symptoms and abnormal X-ray, they'll be asked to provide 2 sputum samples for gene expert test. And for those who have the gene expert test positive, there will be a link to treatment or ongoing care at CHC level, facilitated by the TB district controller. There's some sputum samples will be sent to national level to Laboratory National for confirmatory tests using TB liquid culture. So here's the screening algorithm. It's basically explaining the procedures at the previous slide. What is new here, which I will be talking in the next slide, but we have digital X-ray, AA-powered digital X-ray with the instantaneous result available. And yeah, can you go to the next slide, Chris? So here's the survey progress. So up to now we have visited 5,000, more than 5,000 households, and we've enumerated more than 31,000 with the 77 participation rate, and we screened more than 4,700 people with the 45% cohort male and 55 female with median age 38. For those who we have screened, we found 99% of them has screen positivity, and that bodes from TB symptoms, either TB symptoms or X-ray abnormality. And from 9%, we have just over 1% that has gene expert positive. So yeah, so Timor-Leste was first country to implement TB prevalence survey since the or before the since the COVID pandemic, and we have used several new approaches to TB screening in this prevalence survey context. First, we use AI-powered interpretation of chest X-ray, and this is a game-changing for countries like Timor-Leste, where access to human readers is very limited. However, it comes with the talent challenges, which is the deciding the threshold for abnormality and for abnormality score. So it's basically deciding the threshold to make sure we minimize the highs the false positive test, and then the false negative. So calibrating sensitivity and specificity to different local contexts as a challenge to us. But we've been working through with the experts inputs, and but it's good. It's important to have in mind about this challenge. And the second is the issue of the gene expert rapid test for TB. So it has been in use for some time, but its role in the screening for the prevalence survey is still being established. The use of gene expert as the initial in the screening algorithm enable significant reductions for the culture-based test, which is often a challenge in Timor country, in a low resource country, certainly like Timor-Leste. But the challenge about is that the interpretations of trace and very low positive results in the context of survey case definitions. So it's quite challenging, and especially people with past history of TB. So that is where the next phase of this prevalence survey that we will have to be rigorous in in using the case definitions to be applied for the modeling. Next. Yeah, so to conclude these presentations, our preliminary findings confirm the suggest of high burden TB in Timor-Leste. We found there's a substantial proportion of people who were have TB. They are asymptomatic, which may challenge or impacts the continuous spreading, because people can still those who have symptoms, they are most likely to be treated, but unlike those who are asymptomatic. Next thing is that with the new tools and approach that we have used in this survey, it's a very helpful to us, and it brings, but it also has challenges and complexity, and then the next thing to do is that there's still a lot of work needs to be done with the analysis, and we are expecting to share the final result with the Minister of Health and WHO and our other key stakeholders in early 2024. So here's the our team. So you've got field teams, left side of the PowerPoints, and we have laboratory scientists, our support and admin team, drivers who have helped our team to reach out to the very remote area, very challenging, in a very challenging circumstance. And yeah, so I would like to thank you, Dr. Chris Lowbridge, for his extensive expertise that he brought into this study. We have under the Tropical and Global Health, our Timor-based project lead and deputy, Dr. Jos and Dr. Jen, for their extensive contributions with their leadership and organizational governance. Really appreciate that. Special thank to the Australian government who have funded this project, and our key stakeholders, WHO and National Critical Care and Trauma Response Center. Yeah, that's the end of the presentation, and thank you very much. We're happy to take any questions if there is any.
Great, thanks so much, Dia. That was a fantastic overview of the project, and I also want to really give a shout out to the field teams who are out there doing TB screening today, even though it's a public holiday in Timor-Leste, and this week's actually the last week of field work for the project, which is a huge milestone and achievement. So the field team have been fantastic, working in really challenging circumstances. But yeah, I think we can take a couple of questions.